Good morning. We're back here at 9:18. You know, all week long, we have been having conversations about breast cancer. Caring for your mental health is a really important part of navigating a diagnosis.
So psychologist Dr. Karen Ryan with Nystrom and Associates is here now to talk about how therapy can help breast cancer patients. Doctor, thanks for joining us today. Good to see you.
Good morning. Hi.
We started this week with the idea of talking to people, and the therapy piece was we've talked to people who've suffered breast cancer, or recovered, but we haven't talked about the therapy piece. Why is it important?
Yeah. A lot of people who have breast cancer and experience the diagnosis and the treatment will experience depression or anxiety. Up to 30 to 50% will experience depression, and 20 to 30 will experience some anxiety. And so it's really helpful to stay on top of your mental health throughout the treatment and through your diagnosis and any care that you're getting. And why is it important to do therapy, right? Because a lot of the times we have wonderful friends, we have wonderful family members, and the power of therapy is that it's really focused on you, that you can come in and just be authentically and just talk about everything that you're feeling without any worry about how this other person's gonna feel. So sometimes when you're taking care of your own diagnosis and treatment, you're also caring for your loved ones around you. And the beautiful thing is, like, as a therapist, when my clients come in, they're not worried about me. They don't have to take care of me. So my focus 100%, and the therapist's focus is on what do you need? How are you feeling? It can really help with meditation and mindfulness and awareness, which we know helps process and helps making sure we're not avoiding things. And so there's many different skills that you can learn and incorporate within it. And research shows that that's really helpful, even in reducing certain symptoms that come with breast cancer.
Well, I think about that too. I mean, if you have a diagnosis like this, a breast cancer diagnosis, and you're constantly talking to your friends about it, like, I would start to feel like this is all they hear from me.
And you don't want to bog them down.
You don't want to bog them down, yeah. So maybe the therapist angle gives you that opportunity to unload here and still be that friend and that person that's not weighing your friends down, because it could be hard as the friend to know what to say, to know the right things, to know how to support and care for a friend going through this.
Exactly. And as an individual too going through it, it gives you that opportunity to have a time where you know you're going to intentionally lean in and process and talk about it. And then other times where you can do other things that are really important to you, like connecting with the friends and hearing about them. Exactly.
You mentioned research-based types of therapy that can help. Talk a little bit more about that.
Yeah, thank you. So cognitive behavioral therapy is one that is well researched and shows is helpful for individuals going through breast cancer treatment. And so cognitive behavioral therapy is what it sounds like, where it's the cognitive work. It's how am I thinking about this? How are my thoughts? Where am I maybe going down a worry-based thought? Where can I validate my feelings, but also pull in some logic and reframe? And then behaviorally, it's going to be how can I use certain skills to help myself calm down when I'm feeling more anxious, to navigate and go through these difficult treatments. And so that's cognitive behavioral therapy, which is really helpful. Another one is acceptance and commitment therapy. And so that's really about acknowledging that things are really hard. It's accepting it, radically accepting that I'm going through this really hard thing. But then the focus is, how do I still live my life in a way that fits with my values? And so how do I focus on what's most important to me? So I'm acknowledging that these fears are here. Maybe it's fear of what's happening in the future, or fear of having another experience of breast cancer after you've finished treatment. But it's like, how do I also then make sure I'm still living in a way that feels true to my values? So it's a helpful, like, kind of both and. And then there's interpersonal therapy. And that's your systemic therapy, because we know breast cancer doesn't just affect the individual that has it, it's their families and their loved ones. And so having interpersonal focus in your therapy allows you to think about, how is this impacting my relationships? How does this impact my role as a mother, as a wife, as a sister, as a daughter? And so it gives you that opportunity to think about, how am I approaching things, and how do I have an interpersonally as effective and healthy social system as I possibly can? Because we know that totally impacts your mental and your physical well-being.
So talk a little bit about, I'm thinking about, right, if you're a woman and you've got a family at home and you're dealing with kids and work and spouse and parents, right? How you navigate your diagnosis with everyone is different. How you discuss your diagnosis with your child, depending on their age, is vastly different than how you maybe discuss it with a parent. Or even your spouse. And so I would think that even therapy would help someone better navigate those discussions, because it's not the same with everybody.
Yeah, absolutely. And it gives you that intentional time of exploring, how do I want to do this? And like you said, where we're in a system, the family system, but then we have individual relationships. And so that really helps you be empowered to know, how can I do this well? And how can I connect with this person? And how can I connect with that person and make make sure that those conversations are in a way that are honoring my needs and my boundaries, but also feeling like I'm connecting with that person. And like you said, it's a huge role shift. So for, a lot of women who are the go-getters, who are the coordinators, who are running the system, right, it's a huge change to then be needing to really focus on your own self-care and your own care. And that feels really foreign. And so even settling into this new role of being a patient or being the one who's needing help can be a hard transition, and like being able to really get support on that and process through that can be really helpful.
We just had a graphic up a second ago about existential therapy, and I wanted to go back to this because I think a lot of people, when they do go through a diagnosis like this, they tend to turn to their religion because that's something that it gives them power and it gives them purpose. But how does the therapy piece then go along with that?
Yeah, and it's helpful to recognize when we have a big thing happen in our lives, like a breast cancer diagnosis, what happens is it shifts our worldview, right? It can shift like, how did this happen? Why me? Why not me? How do I make out of this? How do I get through this? And so really helping to process through, like, what does that mean for me? And how am I doing with my faith? How am I doing with my spirituality? Kind of the meaning of the world. And so having a therapist who is able to kind of process that with you and explore that and understand, like, how do I still make meaning and figure out what's most important to me and what are my values and my spiritual beliefs when all this is happening. But you're right, it can absolutely be a huge resource when you do feel like you've got that, when you've got faith and feel like you're not alone, and you've got a therapist to validate that with you, can be really meaningful. And what research shows is that the better we can manage and the less depression somebody has during their breast cancer treatment, the higher their survival rates.
That makes perfect sense.
Yeah, exactly.
You feel like you have a reason to live.
Exactly. When things are feeling better and you feel like you've got the behaviors, you've got the thoughts and process, you've got the interpersonal piece, it really just helps you,
Don't forget about yourself in all this. You're dealing with
100%.
the doctors and you're dealing with the family and getting everything done, but don't forget to take care of you as well.
Exactly.
Dr. Ryan, thank you.
My pleasure.
Really important stuff. Nystrom and Associates does provide care in the fields of psychology, psychiatry, family therapy, and much more.
All right.